Hello, Vetfolio listeners. Thank you for joining us for this podcast sponsored in part by Zoetis. I hope you're excited because today we're talking all about poop. That's right, in this podcast, we're joined by Dr. Corey Penn to discuss fecal exams and how the VETSCAN Imagist from Zoetis can help you get the most out of fecal exams in clinic. We know that effectively diagnosing and treating intestinal parasites is critical to the health and well-being of our patients and their families, and fecal exams in clinic are the first line of defense against intestinal parasite infections. In this presentation, I'll be talking with Dr. Corey Penn about fecal parasite testing and how the VETSCAN Imagist can elevate the accuracy as well as the efficiency of in-clinic fecal examinations. Let me tell you a bit about our speaker and then we'll jump into it. Dr. Corey Penn received his bachelor's degree from Eastern Illinois University and his DVM from the University of Missouri. Before joining Abaxis and Zoetis, Dr. Penn worked as a small animal veterinarian and medical director in Central Illinois. Dr. Penn is a veterinary medical lead for diagnostic instruments with Zoetis. He lives in Illinois with his wife and 3 daughters and their lab Chloe. In his free time, Dr. Penn enjoys spending time with his family and being outdoors. And without further ado, let's jump into our interview.
Hey, thank you so much for having me, and I'm very excited to be here during this exciting time to discuss the most recent breakthrough technology solution to join the Zoetis Diagnostics portfolio with VETSCAN Imagist.
Fantastic. Well, let's just start kind of with the basics. What is the VETSCAN Imagist?
That's a great question. So the VETSCAN Imagist system is a platform that was developed to provide a simpler, easier, and more methodical fecal examination, which is less influenced by different fecal preparation methodologies and or the level or experience of an examiner. It's really composed of 3 elements, which includes a sample preparation device, an automated commercially available scanner, and a data analysis which is done by deep neural networks. The VETSCAN Imagist is powered by these deep learning image recognition technologies to help veterinarians make accurate and timely intestinal parasitic diagnosis for their patients at the point of care.
That's so cool. Anything to help us get an accurate diagnosis and effective treatment plan together, right?
Yeah, absolutely.
Can you talk about why fecal testing is important in veterinary medicine? I mean, I feel like we all kind of know it's important, but maybe we can do just a little refresher.
Certainly, yeah. So the fecal examination for screening and diagnosis of parasitic infections is probably one of the most commonly done laboratory procedures in veterinary practice. Veterinarians are going to recommend fecal testing because it's an important part of that annual examination of our pets, and parasitic infections are still common in dogs and cats. When we think about parasite prevalence, it's really important to consider the population of pets that are being tested, and that's based on their risks. An example would be shelter pets would be a higher risk for having intestinal parasites, along with pets that have a lifestyle that may include hunting, or being outdoors, or attending dog parks, for example. And this has really been shown to be true in recent veterinary publications. In addition, year-round parasiticides are excellent preventative medications, but they don't always guarantee that pets will not have intestinal parasites. It's also important to remember that some parasites, such as roundworms and hookworms, do have that zoonotic potential. And for this reason, the current recommendations from CAPC, or the Companion Animal Parasite Council, is to screen pets at least 4 times during their first year of life by fecal flotation with centrifugation. And then after that first year of life, adult dogs and cats should be screened at least 2 times per year. And that depends on patient health and lifestyle factors.
Absolutely. I mean, here in Florida, we deal with a lot of intestinal parasites, so super important to be on the look for them.
Yeah.
So let's go back over to the VETSCAN Imagist. What components are included in the VETSCAN Imagist?
Great question. So the VETSCAN Imagist is going to consist of 3 different components. The first component is a sample preparation device. And this sample preparation device is an innovative, straightforward device that is utilized to ensure that a normally messy procedure is more contained within a closed system container that requires only 1 gram of feces. What's going to then happen is the sample is then going to be centrifuged so that a centrifugal flotation can be performed, which is the recommended fecal screening test from CAPC. And after centrifugation, the sample is transferred to a microscope slide with a transfer loop, which collects the parasite eggs, cysts, and oocysts that are floating on the top portion of that fecal flotation solution. A customized cover slip is then added that allows for an accurate scan of the cover slip at optimized depths by a whole slide imaging system called the Grundium Ocus scanner. This scanning is really the second major component of the VETSCAN IMAGYST system. Once that scan is complete, the final component of the VETSCAN IMAGYST is the analysis and reporting that is done within the cloud to locate, identify, and classify those common internal parasite eggs, cysts, and oocysts using a deep learning artificial intelligence algorithm. Once the analysis is complete, the quantitative results, along with the images of those classified common internal parasite eggs, cysts, and oocysts, are available for review by the veterinary professional.
So all of that sounds amazing, but I have to say one of the things that really resonated with me was when you said it will contain what is normally a messy procedure. I mean, we've all been there where we're like trying to make this fecal float and it's on your hands and everywhere. So that sounds very appealing in and of itself.
Absolutely. Yep. It's all contained within that sample preparation device.
Perfect. What kind of parasites can the VETSCAN IMAGYST locate, identify, and classify?
Yeah, so the VETSCAN IMAGYST can locate, identify, and classify 6 target parasites. So when we think about that, it can identify hookworms with Ancylostomous species in dogs and cats, roundworms with Toxicara species in dogs and cats, whipworms with Tricharis vulpes in dogs, Cystoisospora species in dogs and cats, which is Coccidia, tapeworms in dogs and cats with the Taenidae family, and Giardia species in dogs and cats.
So a lot of the common parasites that we would really be looking for.
Absolutely.
So I've been doing old-fashioned fecal flotation techniques when looking for intestinal parasites for a long time. Why the change? Why isn't advanced testing like the VETSCAN IMAGYST system needed for fecal testing?
I think that's a great question. And when we think about manual testing, there are numerous factors that can influence the accuracy and the use of fecal flotation testing. When we think about the fundamental technical factors that influence the ability to detect parasites, those could include how much fecal material is examined, whether or not a centrifuge is utilized, the choice of a flotation solution, or even the length of time that flotation process is allowed. And in addition to that, there's that personal factor that centers on the technical proficiency, even when the veterinary personnel are following the same set of directions. So if we look at a study that was published in 2009, it was concluded that passive fecal flotation examinations run in private practice may be missing up to 50.5% of infected dogs as a result of error in reading the slide or limitations of the passive flotation technique. So although a microscopic examination of fecal slides, should be done carefully and thoroughly by veterinarians or trained technician, this type of time is not often available, and analysis is oftentimes conducted rapidly by staff, maybe with limited training or experience or understanding. And the VETSCAN IMAGYST was developed to provide that simpler, easier, and more systematic fecal examination, which is less influenced by different fecal preparation methodologies and or level or experience of the examiner.
So one of the things you mentioned as being responsible for some of the variation we see in our results is the type of flotation solution that's utilized. What are the flotation solutions that are utilized by the VETSCAN IMAGYST?
Sure. So when we think about flotation solutions, it's really important to remember that there is no perfect solution. And when we decide on the use of a solution, we need to consider a couple of things. And that may include the specific gravity of the solution, the viscosity of the solution, or maybe even the rate of water loss of the parasite egg, cyst, or oocyst caused by the hypertonicity of that particular solution. So when we think about it, we should always look at the advantages and disadvantages and consider those when selecting a solution for general use with centrifugal flotation. And a couple of important points to think about is that zinc sulfate is really the preferred solution for detecting Giardia cysts. And another point to consider is that sheath or sugar solution causes less damage to parasite eggs and oocysts than salt solutions. So there are two different flotation solutions that are available for utilization with the VETSCAN IMAGYST. And this includes a zinc sulfate and an Apofix sheath or sugar solution. Each are pre-measured and pre-packaged in the ParaPro collection tubes. And there are clinical indications, especially with sick animals showing signs of diarrhea, that it would be reasonable to run both a VETSCAN IMAGYST Apofix sugar and zinc sulfate solution sample side by side for that more complete diagnostic evaluation.
Absolutely. Best of both worlds.
Sure.
Can you tell us a little bit about how the performance of the VETSCAN IMAGYST was verified?
Absolutely, and I think this is so exciting. So there were two studies that were performed for the verification of the VETSCAN IMAGYST platform for use in dogs and cats. And both studies were performed at Oklahoma State University under the direction of Dr. Yoko Nagamori, who is a board-certified clinical parasitologist. For the first study, the target parasites for verification were roundworms, hookworms, whipworms, and tapeworms. And for the second study, the target parasites for verification on the VETSCAN IMAGYST were roundworms, hookworms, coccidia, and giardia. So when we think about the two studies, there was really two objectives for each of the studies. The first objective was to assess the performance of the VETSCAN IMAGYST sample preparation method in comparison to the standard reference methods of fecal centrifugation. And the second objective was to evaluate the accuracy of the VETSCAN IMAGYST system to correctly identify those internal parasite eggs, cysts, and oocysts in feces of naturally infected dogs and cats as compared to a manual evaluation by an expert board-certified veterinary parasitologist. So in the studies, we were able to conclude that, the innovative, easy-to-use closed system sample preparation device was shown to be comparable to the performance of conventional centrifugal flotation as read by an expert clinical parasitologist with manual microscopy. In addition, since we had an equal number of dogs and cats, the sample preparation devices performed similar with cat samples, which often have a different fecal consistency from dogs due to their diet. We were also able to conclude in the studies that the algorithm performed well versus an expert clinical parasitologist evaluating the same sample slide with expert focus and attention. And that's something that's likely not being done with each internal parasite screening in everyday practice.
Absolutely. Yeah, it like you said earlier, sometimes it varies with the training, but I certainly wouldn't call myself an expert
Oh,
parasitologist.
me neither. Me neither. Absolutely.
So we try to be as efficient as possible when we're doing these things, but there's some personnel time involved when we're running a fecal float. What's the turnaround time for the VETSCAN IMAGYST?
Another great question. So when we think about sample processing, and this is going to include collecting and preparing the sample for centrifugation, as well as a 2-minute centrifugation. This is going to require about 5 minutes of time. After that process, the sample is added to the slide and the cover slip is placed prior to the scanning, which is going to take about 9 minutes. After that 9-minute scan is done, the results can be reviewed. So when we think about our total time to result, it's about 15 minutes. The hands-on time for the veterinary professional is minimal after that sample collection and preparation because the scanner is providing the analysis instead of having a veterinary professional doing that microscopic analysis. And this allows the veterinary professional to do other tasks and, while that scanning and analysis of that scan is taking place.
Wow, so ultimately a real boost in efficiency for a similar turnaround, but like you said, we're not involved in reading and doing these things the whole time.
Yeah, absolutely.
Once we get our results, how are the results from the VETSCAN Imagist reported?
Sure. So after completion of analysis on the VETSCAN Imagist, the sample results can be opened to review any of the captured images and select examples for inclusion in the report on the VETSCAN Imagist web application. Comments can be added to the report before it is saved, and once the report is saved, it is able to be viewed as a shareable PDF within the Imagist application and also be viewed on the VETSCAN Fuse as well as in the Practice Information Management Software, also known as the PIMS. For veterinary hospitals, they're going to benefit greatly from the automatic upload of that final report into the PIMS, such as would be done if they were sending out to a reference lab for analysis. This is a very different and much improved workflow to what is currently done with manual fecal evaluations in the hospital. So this will decrease the overall workload for the veterinary staff and decrease those transcription errors versus manual input. But it also provides that data that we can trend and images for review, which are especially important in those positive cases that are being treated. Finally, VETSCAN Imagist does provide images of parasite eggs, cysts, and oocysts that can be shared with our veterinary clients to provide value and act as that education tool. When we think about the veterinary client, a negative test provides that peace of mind regarding their pet's health and really can be celebrated. If the test is positive, we're able to initiate that treatment immediately, and this may help with owner compliance with treatment and preventative measures in the future. Also, the report is going to allow for an increase in perception of the value of the fecal examination. On the report, there are pictures with the formal report, so the client can actually see any parasite egg, cyst, or oocyst that have been detected in their pet's feces.
Oh, I'm sure they love that.
Yes, yeah, really seeing is believing.
Absolutely, absolutely. So let's kind of go to the take-home message. What benefits can the VETSCAN Imagist bring to a veterinary practice?
Sure. So again, the VETSCAN Imagist was developed to provide a simple, easy, and more systematic fecal examination, which is not related to the level of expertise or experience of the veterinary professional or the person who's examining the feces. The VETSCAN Imagist report and images also provide immense value to both veterinarians and pet owners, as accurate results and treatment, if necessary, can be provided at the time of the veterinary visit.
Absolutely. So if we wanna bring it on board, what capabilities does a practice need to have to support the VETSCAN Imagist?
Sure, this is another great question. And when we think about, what do we need in our veterinary practice? The good news is we need minimal counter space. So the scanner dimensions are 8 inches by 8 inches by 8 inches, and it weighs about 8 pounds. So it's very small. We do need normal to high bandwidth internet for uploading of images to the cloud for analysis, and we recommend that 10 megabytes per second upload speed. We also need a centrifuge to be able to do that centrifugal flotation process.
Wow, eight by eight by eight. You're right. That is minimal counter space. That's not very
It's,
big at all.
yes, absolutely. So small and wonderful.
Awesome, awesome. Well, fantastic. Thank you so much for coming on the podcast today and for all of this great information, Dr. Penn.
Hey, thank you for taking the time with me today. It was truly a pleasure to talk with you. And for anyone who wants to learn more about VETSCAN Imagist, please go to vetscanimagist.com to learn more.
Thank you again, Dr. Penn, for all that great information about the VETSCAN Imagist and all that it can do to help with fecal exams in the clinic. And thank you to Zoetis for sponsoring this event. If you'd like to find out more about this and other exciting podcasts, click on the Education tab on Vetfolio's portal. As always, we'd love to hear your input on this session, as well as ideas for topics you'd like to hear from us in the future. Feel free to reach out to me at dvm@vetfolio.com. You can also visit my Facebook page at Dr. Cassie DVM, and you can find me on LinkedIn. And remember, if one animal is better off because of you today, it's a great day.